Many heart attacks do not begin the way people imagine. They rarely start with a sudden dramatic collapse or a sharp pain out of nowhere. In many cases, the body has already been sending signals for weeks, months, and sometimes even years. The problem is that those signals are often quiet, confusing, or easy to dismiss. I am Dr. Warren Hung, and on this channel we focus on understanding how the body actually works so that you can protect your long-term health. If you care about learning the science behind everyday health decisions and how to recognize early warning signs before serious disease develops, consider subscribing. We focus on clear explanations that help you understand what your body may be trying to tell you. One of the most common misunderstandings about heart attacks is the idea that they appear suddenly, without warning. In reality, the heart usually struggles long before the final event occurs. To understand why, it helps to look at how the heart receives its blood supply. The heart is a muscle. Like any muscle, it needs oxygen and nutrients to function. But the heart does not receive oxygen from the blood inside its chambers. Instead, it relies on its own dedicated blood vessels, called coronary arteries. These arteries sit on the surface of the heart. Their job is simple but vital. They deliver oxygen-rich blood directly into the heart muscle. When these arteries are healthy and open, blood flows freely. The heart muscle receives the oxygen it needs to contract, relax, and pump blood to the rest of the body. The problem begins when these arteries slowly become narrowed. The most common cause is a process called atherosclerosis. This term simply means the gradual buildup of fatty deposits, inflammatory cells, and scar-like tissue inside the walls of arteries. Over time, these deposits form structures, known as plaques. Plaques do not appear overnight. They grow slowly, often over decades. As they enlarge, they reduce the internal space through which blood can flow. For a long time, the body can compensate for this narrowing. At rest, the heart may still receive enough oxygen, even if an artery has already lost a large portion of its normal width. This is why many people with significant coronary artery disease feel completely normal while sitting, resting, or performing light activities. The challenge appears when the heart needs to work harder. During exercise, emotional stress, climbing stairs, or even walking quickly, the heart muscle suddenly requires more oxygen. It must beat faster and pump more forcefully. In a healthy heart, the coronary arteries respond by widening. This allows more blood to flow through them, delivering the extra oxygen the heart muscle needs. But when plaques narrow those arteries, that widening response becomes limited. The result is that the heart muscle may temporarily receive less oxygen than it needs. Doctors call this situation ischemia. The word simply means reduced blood flow to tissue. When the heart muscle becomes ischemic, it often produces symptoms. These symptoms are not random. They are the body's way of signaling that the heart is under strain. The important point is that this process often begins long before a heart attack. A heart attack usually occurs when a plaque inside a coronary artery ruptures and forms a clot that suddenly blocks blood flow completely. That final blockage can severely damage the heart muscle within minutes. But the artery that eventually becomes blocked is often already narrowed beforehand. And during that earlier stage, the heart may repeatedly experience short episodes of reduced oxygen. Each episode can produce warning signals. The difficulty is that these signals rarely appear in dramatic ways. They may look like simple fatigue. They may feel like mild pressure in the chest. They may appear as breathlessness while walking uphill. Because these symptoms are subtle, many people assume they are caused by aging, stress, poor sleep, or lack of fitness. Yet from a physiological perspective, they may represent the heart struggling to receive enough oxygen during periods of increased demand. Research from the Framingham Heart Study, one of the longest-running cardiovascular studies in history, has shown that coronary artery disease often develops silently for years before the first heart attack occurs. The study began in 1948 and has followed multiple generations of participants to understand how heart disease develops. One consistent finding is that many patients report symptoms that, in hindsight, reflected reduced coronary blood flow before their first major cardiac event. This does not mean every episode of fatigue or chest discomfort is related to the heart. The human body produces many sensations for many reasons. But it does mean the heart often gives early signals when its oxygen supply begins to struggle. Understanding these signals matters because they provide an opportunity. They allow doctors to identify coronary artery disease before a major blockage occurs. And this leads to an important question. If the body often sends warning signals before a heart attack, why do so many people miss them or misunderstand what they mean? And the answer lies in how the brain interprets the body's signals when blood flow to the heart begins to fall. When the heart begins to struggle with its blood supply, the signals it produces are not always clear. Many people expect heart problems to feel like a sharp, dramatic pain in the center of the chest. In reality, the body often communicates in much subtler ways. To understand why, it helps to look at how the heart and the nervous system interact. The heart muscle is controlled partly by the autonomic nervous system. This is the automatic control system of the body. It regulates functions you do not consciously manage, such as heart rate, blood pressure, digestion, and breathing. Two branches of this system constantly balance each other. One branch increases heart activity during stress or exertion. The other slows things down when the body is resting. When the heart muscle receives less oxygen than it needs, the autonomic nervous system reacts immediately. It attempts to compensate by increasing heart rate, adjusting blood pressure, and activating various stress signals throughout the body. But the brain does not always interpret these signals as a heart problem. Instead, the sensations are often perceived as fatigue, mild discomfort, indigestion, or shortness of breath. These interpretations happen because the nerves that carry signals from the heart share pathways with nerves from other parts of the body. This phenomenon is called referred sensation. Referred sensation means the brain cannot always pinpoint exactly where a signal is coming from. Signals originating in the heart may be perceived as discomfort in the chest, but they can also appear in the arm, jaw, neck, upper back, or stomach. From a neurological perspective, the brain is simply receiving distress signals. It must decide which body part is responsible. Sometimes it guesses incorrectly. This is one reason heart-related symptoms can appear very different from person to person. Another factor is the way coronary artery disease develops over time. In many cases, the narrowing of coronary arteries progresses gradually. The heart adapts to this slow reduction in blood flow. It develops small compensations that allow the muscle to continue functioning despite partial oxygen limitation. Because of these adaptations, symptoms may only appear during periods when the heart suddenly needs more oxygen. Walking uphill, carrying groceries, climbing stairs, experiencing emotional stress. During these moments, the heart must pump harder. Oxygen demand rises quickly. If the coronary arteries cannot deliver enough blood, the heart muscle briefly enters a state of ischemia. That temporary oxygen shortage produces symptoms. But once the activity stops and the heart slows down again, blood flow may become sufficient once more. The symptoms disappear. From the patient's perspective, the episode may seem minor and temporary. This pattern is known in medicine as stable angina. The term angina refers to discomfort caused by reduced blood flow to the heart muscle. Angina is not the same as a heart attack. During angina, blood flow is reduced but not completely blocked. The heart muscle remains alive, although it is temporarily stressed. Doctors have known about angina for centuries. The British physician William Heberden described the condition in the 1700s after observing patients who developed chest pressure when walking, but improved when they stopped and rested. Modern research has confirmed that angina is often one of the earliest recognizable signals of coronary artery disease. Large observational data from the Framingham Heart Study and later analyses of cardiovascular registries have shown that a significant portion of patients report warning symptoms before their first heart attack. These symptoms may appear weeks or months earlier. The challenge is that people rarely connect these sensations to the heart. A patient once showed me a notebook filled with blood pressure readings he had been recording at home. He was in his early 70s and very careful about tracking his health. While reviewing his notes, he casually mentioned that he had started feeling unusually tired during his daily walks and occasionally felt pressure in his chest when climbing a hill near his home. He assumed it was simply part of getting older. What this illustrates is something important about how the cardiovascular system behaves. The heart often signals reduced blood flow during periods of increased demand, long before a major blockage develops. Many patients interpret these early symptoms as normal fatigue, digestive discomfort, or muscle strain. The brain tends to favor simple explanations that match everyday experiences. Another reason these signals are missed is that they may appear intermittently. Symptoms may occur during physical activity one day and disappear the next. They may appear only during emotional stress or after heavy meals, when the body is already directing blood toward digestion. Because the episodes are short and unpredictable, they are easy to dismiss. Age can also change how symptoms appear. Older adults, people with diabetes, and women sometimes experience less typical warning signs. Instead of chest pressure, they may notice breathlessness, fatigue, nausea, or dizziness. This variation occurs partly because long-term metabolic conditions can affect nerve sensitivity and the way the brain interprets internal signals. Studies from the American Heart Association and data collected through the National Health and Nutrition Examination Survey, NHANES, have documented these differences across populations. Yet despite these variations, the underlying cause is often the same. The heart muscle is briefly receiving less oxygen than it needs. And when that happens, the body tries to communicate the problem. The signals may appear in the chest, the arms, the stomach, or the breathing pattern. They may show up during physical activity or emotional stress. But in many cases, the body is already giving early warnings that the coronary arteries are narrowing. Understanding these warnings is important because they often appear before the most dangerous stage of heart disease. And the most recognizable of these signals tend to follow patterns that doctors have observed repeatedly in patients long before a heart attack occurs. When coronary arteries begin to narrow, the heart muscle can usually cope while the body is resting. The problem appears when the heart suddenly needs more oxygen than the arteries can deliver. At that moment, the heart muscle briefly enters ischemia, meaning reduced blood flow and reduced oxygen supply. Ischemia irritates the nerve endings inside the heart and activates the autonomic nervous system. Those signals are what the body interprets as symptoms. Doctors have observed certain patterns repeatedly in patients with early coronary artery disease. These patterns do not guarantee that a heart attack will occur, but they often appear before the arteries become critically blocked. The first 4 warning signs usually involve the way the heart responds to physical effort or stress. Warning. Sign 1. Chest pressure or tightness during activity. The most recognized early warning sign is a sensation of pressure, squeezing, or tightness in the chest during physical activity. Many people expect heart pain to feel sharp. In reality, cardiac discomfort is usually described as pressure or heaviness rather than stabbing pain. This sensation often appears when the heart is working harder than usual. Activities such as climbing stairs, walking uphill, carrying heavy objects, or exercising can increase the heart's oxygen demand. If a coronary artery is partially narrowed, the increased demand may exceed the available blood supply. The heart muscle becomes temporarily deprived of oxygen. The nerve fibers inside the heart respond by sending distress signals through the chest nerves toward the brain. The brain interprets this signal as pressure or tightness in the center of the chest. In many cases, the sensation improves within minutes after stopping the activity. Once the heart slows down and oxygen demand falls, blood flow may again become sufficient. Doctors refer to this pattern as exertional angina. The connection between exertion and chest pressure has been documented in clinical cardiology for decades. Data from the Framingham Heart Study helped confirm that chest discomfort triggered by physical effort is one of the classic patterns associated with coronary artery disease. The key point is that the symptom often appears during effort and disappears during rest. Many people dismiss this signal as muscle strain or fatigue, but from a physiological perspective, it may represent the heart temporarily struggling to receive enough oxygen. Warning. Sign 2. Unusual shortness of breath. Another early warning sign is shortness of breath during activities that previously felt easy. This symptom may appear when walking at a normal pace, climbing stairs, or performing routine household tasks. Shortness of breath occurs because the heart and lungs work together to deliver oxygen to the body. When the heart muscle receives less oxygen, its pumping efficiency can temporarily decrease. The body senses that oxygen delivery is falling and tries to compensate by increasing breathing. The brain interprets this response as breathlessness. From the outside, the lungs may appear normal. The person may not have any underlying lung disease. Yet the sensation of air hunger appears because the cardiovascular system is struggling to deliver enough oxygen-rich blood. Cardiology research has shown that shortness of breath can sometimes appear as an equivalent symptom of angina. Instead of chest pressure, the body expresses cardiac stress through breathing difficulty. Clinical guidelines from the American Heart Association, AHA, and the European Society of Cardiology, ESC, both recognize unexplained exertional breathlessness as a possible symptom of myocardial ischemia. This symptom may appear gradually. A person who once walked comfortably may notice that the same distance suddenly feels more exhausting. Because the change often develops slowly, it is easy to attribute it to aging or reduced fitness. But physiologically, it may reflect the heart receiving less oxygen during exertion. Warning. Sign 3. Pain. Spreading to the arm, jaw, neck, or shoulder. A third warning sign involves discomfort that spreads beyond the chest. This symptom is related to the concept discussed earlier, known as referred sensation. The nerves that carry signals from the heart enter the spinal cord at levels similar to the nerves that supply the arm, neck, and jaw. Because these pathways overlap, the brain sometimes interprets heart-related signals as pain coming from those other areas. As a result, cardiac discomfort may appear as aching or pressure in the left arm, the jaw, the neck, or the shoulder. In some cases, the discomfort begins in the chest and then spreads outward. In other cases, the chest may not hurt at all, and the pain appears mainly in the arm or jaw. Large clinical studies have documented this pattern. Data from the InterHeart study, a global investigation of heart attack risk factors involving more than 50 countries, found that pain radiating to the arm or jaw is a common symptom among patients experiencing myocardial ischemia. The discomfort may feel dull, heavy, or aching rather than sharp. Because these areas are commonly associated with muscle strain or joint tension, many people assume the sensation comes from the shoulder or neck rather than the heart. But in the presence of coronary artery narrowing, these sensations may represent the nervous system transmitting signals from an oxygen-starved heart muscle. Warning. Sign 4. Sudden, unexplained fatigue. The fourth warning sign is persistent fatigue that appears without a clear reason. Fatigue can have many causes, including poor sleep, infection, hormonal changes, or emotional stress. But in some cases, it may reflect reduced efficiency in the cardiovascular system. The heart is responsible for delivering oxygen and nutrients to every organ and tissue in the body. When coronary arteries narrow, the heart may struggle to maintain optimal pumping performance, especially during periods of activity. The body senses that tissues are receiving slightly less oxygen than usual. As a result, everyday tasks begin to feel more exhausting. Some patients describe this sensation as a sudden drop in stamina. Activities that once felt routine begin to require more effort. Research published through the American Heart Association's Circulation Journal has documented fatigue as a frequently reported symptom in patients before certain cardiac events, particularly among older adults and women. Because fatigue is such a common experience in daily life, it is rarely interpreted as a cardiovascular signal. Yet, in the context of coronary artery disease, fatigue can represent the body responding to reduced oxygen delivery and increased cardiac strain. These first 4 warning signs share a common mechanism. They appear when the heart muscle briefly receives less oxygen than it needs. But the body can produce additional signals as the nervous system reacts to stress in the cardiovascular system. And the next group of warning signs often appears through the digestive system, the sweat response, and the body's balance mechanisms. The first 4 warning signs we discussed mainly appear when the heart muscle is working harder than usual. They reflect the moment when the heart demands more oxygen than the coronary arteries can provide. The next group of warning signs is different. These symptoms often appear because the body's autonomic nervous system reacts strongly when the heart becomes stressed. This system controls automatic functions such as sweating, digestion, blood pressure, and balance. When the heart muscle begins to struggle with its oxygen supply, the nervous system may activate protective responses across the entire body. Those responses can create symptoms that do not immediately seem related to the heart. Warning. Sign 5. Nausea, indigestion, or upper stomach discomfort. Many people are surprised to learn that heart problems can sometimes feel like digestive issues. Instead of chest pressure, some individuals experience nausea, stomach discomfort, or a sensation that resembles indigestion. This occurs because the heart and the upper digestive system share nerve pathways that travel through the chest and upper abdomen. When the heart muscle becomes ischemic, the nervous system may misinterpret the distress signal as coming from the stomach. The result can be symptoms such as nausea, a heavy feeling in the upper abdomen, mild stomach pain, a sensation similar to heartburn. These sensations can appear during physical activity or emotional stress, especially if the heart is struggling to maintain adequate blood flow. Another reason digestive symptoms appear is related to blood circulation. When the body senses cardiovascular stress, it may redirect blood flow away from the digestive system and toward the heart and brain. This shift can disrupt normal stomach function and create feelings of nausea. Clinical research has documented this connection for many years. Observational data referenced in American Heart Association, AHA, clinical reviews has shown that gastrointestinal symptoms can appear before or during cardiac ischemia, particularly in older adults and women. Because indigestion and stomach discomfort are common experiences, people rarely associate them with the heart. But in the presence of coronary artery disease, these sensations may reflect the nervous system responding to cardiac stress. Warning sign 6. Cold sweats or clammy skin. Another signal the body may produce during cardiac stress is sudden sweating that appears unrelated to heat or physical exertion. This type of sweating often feels different from normal perspiration. Instead of gradually appearing during exercise or warm weather, it may occur suddenly and leave the skin feeling cool, damp, or clammy. The reason lies in how the autonomic nervous system reacts to perceived danger. When the brain senses that the heart may be under strain, it activates the sympathetic nervous system, sometimes called the body's fight-or-flight response. This response increases heart rate, raises blood pressure, and stimulates sweat glands across the skin. Sweating serves an evolutionary purpose. It prepares the body to regulate temperature during sudden stress or exertion. However, during cardiac ischemia, this reaction can occur even when the person is resting. The individual may suddenly feel sweaty, cool, or pale without any obvious reason. Medical literature has long described this response in association with cardiac distress. Clinical descriptions compiled by the European Society of Cardiology, ESC, and the American College of Cardiology, ACC, note that unexplained sweating can occur during episodes of reduced blood flow to the heart. Because sweating can also occur during anxiety, illness, or changes in room temperature, this signal is easy to misinterpret. But when it appears together with other symptoms such as chest pressure or breathlessness, it may indicate the nervous system responding to cardiovascular strain. Warning sign 7. Lightheadedness or sudden dizziness. The final warning sign involves the body's balance and circulation systems. Some individuals experience episodes of dizziness, lightheadedness, or a feeling that they might faint. This symptom can appear when the heart struggles to maintain adequate blood flow to the brain. The brain is extremely sensitive to oxygen levels. Even small reductions in blood flow can create sensations of imbalance or dizziness. When the heart muscle becomes ischemic, its pumping efficiency may temporarily decrease. Blood pressure may drop slightly, or circulation to the brain may fluctuate. The nervous system detects this change quickly. The person may feel lightheaded or unstable, especially during physical activity or emotional stress. Another contributing factor is the reflex response of the autonomic nervous system. When the body detects cardiac distress, it may trigger rapid adjustments in heart rate and blood vessel tone. These rapid shifts can briefly disrupt normal circulation and produce dizziness. Clinical evidence has linked episodes of unexplained lightheadedness with certain cardiovascular conditions. Data discussed in cardiology guidelines from organizations such as the American Heart Association, AHA, recognize dizziness as a possible symptom associated with reduced cardiac output or transient ischemia. However, dizziness alone is not specific to heart disease. It can also occur with dehydration, low blood sugar, inner ear disorders, or medication side effects. What matters clinically is the pattern. If dizziness appears together with symptoms like chest pressure, shortness of breath, fatigue, or sweating during exertion, doctors consider the possibility that the cardiovascular system may be involved. When viewed together, these 3 warning signs reflect the body's broader response to cardiac stress. The digestive system reacts. The sweat response activates. The balance system may become unstable. All of these signals originate from the same underlying issue. The heart muscle may not be receiving enough oxygen during periods of increased demand. These warning signs do not guarantee that a heart attack will occur, but they can indicate that the coronary arteries may already be narrowing and that the heart is beginning to struggle under certain conditions. And understanding how these signals fit together requires looking at the larger process that eventually leads to a heart attack. The 7 warning signs we discussed may appear very different from one another. Chest pressure, shortness of breath, pain in the arm or jaw, fatigue, digestive discomfort, cold sweats, dizziness. At first glance, these symptoms seem unrelated. One affects breathing, another affects the stomach, another affects the skin. Yet, inside the body, they often originate from the same underlying process. That process usually begins with coronary artery disease. As explained earlier, coronary arteries supply oxygen-rich blood to the heart muscle. Over time, fatty deposits and inflammatory cells can accumulate inside the walls of these arteries. These deposits form plaques that slowly narrow the passage through which blood flows. For many years, this narrowing may produce no obvious symptoms at rest. The heart continues to receive enough oxygen during quiet activities. The difficulty appears when the heart needs to work harder. During physical effort, emotional stress, or sudden increases in heart rate, the heart muscle demands more oxygen. Healthy arteries respond by widening and allowing additional blood to flow. Narrowed arteries cannot expand as effectively. The result is a temporary imbalance between oxygen supply and oxygen demand. Doctors call this situation myocardial ischemia. Myocardial refers to the heart muscle. Ischemia means reduced blood flow. When ischemia occurs, the heart muscle does not immediately die. Instead, it becomes stressed. Nerve endings inside the heart detect this stress and send signals through the autonomic nervous system. Those signals are what the brain interprets as the symptoms we discussed earlier. The chest may feel tight because nerves from the heart transmit pain signals through the chest wall. Breathing may become difficult because the body tries to increase oxygen delivery. Sweating may occur because the sympathetic nervous system activates a stress response. Digestive discomfort may appear because the heart and stomach share nerve pathways. Dizziness may develop because circulation to the brain briefly changes. Each of these responses represents a different way the body reacts to the same underlying stress. The heart is not receiving as much oxygen as it needs. At this stage, the problem is often still reversible. The coronary artery may be narrowed but not completely blocked. Blood flow is reduced, but the heart muscle remains alive. Doctors often refer to this stage as stable coronary artery disease. In this phase, symptoms typically appear during exertion and improve with rest. However, a heart attack usually involves a second event. Inside a coronary artery, a plaque may become unstable. The surface of the plaque can rupture or tear. When this happens, the body interprets the rupture as an injury inside the blood vessel. Platelets, which are the cells responsible for blood clotting, rush to the area to form a clot. If that clot becomes large enough, it can suddenly block the artery. When blood flow stops completely, the section of heart muscle supplied by that artery begins to lose oxygen rapidly. Without oxygen, heart cells start to die within minutes. That is what doctors call a myocardial infarction, the medical term for a heart attack. Understanding this sequence helps explain why early warning signs matter. The symptoms we discussed often occur during the earlier stage, when arteries are narrowed but not yet fully blocked. At this point, the body is essentially signaling that the heart muscle is struggling during periods of increased demand. Recognizing those signals can lead to earlier medical evaluation. Doctors can assess heart health using several tools, including stress testing, imaging of coronary arteries, and blood tests that evaluate cardiovascular risk. Large population studies have demonstrated the importance of identifying coronary artery disease early. The Framingham Heart Study, which has followed multiple generations for more than 70 years, helped establish many of the major risk factors for heart disease, including high blood pressure, high cholesterol, smoking, diabetes, and obesity. These factors contribute to plaque formation inside coronary arteries. Other major investigations, including the InterHeart study, which examined heart attack risk factors across more than 50 countries, confirmed that a large proportion of heart attacks are linked to modifiable lifestyle and metabolic risks. Understanding the physiology behind warning signs does not mean every symptom indicates heart disease. Fatigue may come from poor sleep. Indigestion may come from diet. Shortness of breath may come from lung conditions. The human body is complex, and many systems interact. What matters medically is the pattern. Symptoms that appear repeatedly during physical exertion, emotional stress, or increased heart demand deserve attention. They may represent the heart, asking for more oxygen than narrowed arteries can provide. Distinguishing between symptom control and cause regulation is also important. Treating a symptom means addressing how the body feels in the moment. Regulating the cause means addressing the underlying condition affecting the cardiovascular system. For example, medications may reduce chest discomfort by improving blood flow or lowering heart workload. But long-term cardiovascular health also depends on managing the processes that lead to plaque formation in the first place. These processes include blood pressure regulation, cholesterol metabolism, inflammation, glucose control, and lifestyle factors such as diet, physical activity, and smoking exposure. Clinical guidelines from organizations such as the American Heart Association, the European Society of Cardiology, and the World Health Organization emphasize prevention as a central strategy in reducing heart attack risk. The reason is simple. Atherosclerosis develops slowly over time, but the earlier it is recognized, the more opportunities exist to slow its progression and protect the heart muscle. If you want more explanations like this that help clarify how the body works and how different health systems connect, you can subscribe to the channel. Understanding the physiology behind common conditions can make everyday health decisions easier to navigate. The heart is an extremely resilient organ, capable of beating more than 100,000 times per day for decades. Yet, like any muscle, it depends on a steady supply of oxygen. When that supply begins to fall, the body often sends signals long before a major cardiac event occurs. Learning to recognize those signals is one of the most important steps in protecting long-term cardiovascular health.